A bunion typically is a prominence that people will see on the inside part of their foot. It's a protrudence of the bone that people will see, and right away people will think that it's just an extra bone growth. But what it really is their normal anatomy that's starting to shift. They actually get a subluxation of the joint, and the normal anatomy starts to shift. As you can see here, the normal anatomy, this is the metatarsal, will start to shift, and as it starts to shift, it will protrude along the side of the skin, and they will see this prominence along the side of the toe. Bunions typically are very painful because, again, there is not that much padding along the side of the foot. It's pretty much bone, soft tissue, and nerve. So when you have this protrudence of the foot, you get a widening of the foot. And when the foot's widened and people are trying to fit themselves back into their original shoe, they get rubbing. And when they get rubbing, it rubs along the nerve, it rubs along the bone, and the bone and nerve start to hurt. Sometimes they will even describe a numbness feeling in their foot or a burning sensation. And that is the rubbing of the shoe along the side of the bone onto the nerve. Bunions is not hereditary, it is the foot type that is hereditary. People will develop certain foot types where they have a lot of mobility in their feet or laxity, and that predisposes them to develop bunions. What that means is that their joints, especially in their foot part, will be very lax or loose, meaning that there's a lot of play and a lot of motion in that joint. When that occurs, it allows for a lot of external forces to play on that joint and create a bunion. So, for example, if you have a lot of motion in this joint, the joint can move around, and you require more of a stability when walking. So if there's any play on the ground forces, the ground forces would push up on the bone, and you get more motion in that joint where you shouldn't have it. Plus the external force of the shoe pressing on the toe, it will create almost a backward force or a retrograde force onto the toe and create this protrudence of the bone, which that will create the bunion. So inherently, again, the bunion is not hereditary, but the foot type that predisposes the person to develop the bunion is. Typically, what most people will see is when they hear bunion, they think of a bunion that's on the side of the foot, which typically is seen by the protrudence of the joint to the side of the foot. But people can also develop bunions or spurring, per se, on top of the foot, and that typically is seen more with people who have wider shoes like males. Males will develop more of a bunion that's on top of the foot because they still have that instability, but they don't have that external force like women's shoes. Typically, women will develop the bony prominence along the side of the foot, and the reason why they develop it along the side of the foot is because of the inherent narrowness of women's shoes. The narrowness of the shoes will put pressure along the toe, and that will create that bone shifting outwards. But men can also have that type of foot type. With men, though, they don't have narrow shoes. They have more wider shoes. So they don't have that inherent external force that's putting pressure on the toe. But typically, not always, they will develop more of a bunion that's on top of the joint. And that's because they get jamming into the joint, and they get it more on top versus on the side. With all type of treatments, we always try to treat any condition conservatively. Specifically with bunions, we always want to try to see if we can address it with any type of padding, getting the patient into wider shoes. We try to see really what is causing the problem. If it's a typical shoe that they're wearing, maybe we can avoid wearing that shoe to prevent any pressure on that bunion. So with shoe wear, padding, even wearing orthotics, which we can somewhat prevent the progression of bunions. But really with the orthotic, we're looking more at our juvenile patient or adolescent pediatric patients who have some instability in their feet and they're starting to get their prominence. We want to either slow the progression of the bunion or prevent it. Later on in life, really, when we're beyond the ages of growth, we really can address the bunion with an orthotic, more with, again, padding and shoes. And if those conservative measures or care has been failed, then we can address it surgically.